Manjunath. I am a physical therapist, post-graduation in sports medicine. I am working in Vivekananda Hospital last 18 years. Today I am going to discuss pain management. Mainly the pain management, totally 12 types of pain management. Pain is mainly regularly we can see 3 types of pain. One is nociceptive pain, neuropathic pain and physiological pain. What is nociceptive pain means? Is any soft tissue injury like any bruise, swelling, fall, tissue damage, we call it as nociceptive pain. Neuropathic pain is radiculopathic pain like cervical radiculopathy and lumbar radiculopathy. These are the neuropathic pain. Third one is pseudo pain, otherwise physiological pain. That's the patient is psychological pain. Sometimes patient they don't know where exactly pain. They radiates somewhere and deep pain somewhere. They falls. Nociceptive pain is first one. It's a soft tissue pain. So what is the first initial treatment is the 3 types: acute and subacute and chronic pain. Acute we have to give to the rest to the patient, and subacute also rest, and chronic then only we have to move the patient or mobilize the patient. This is classification 1 and 2. Pain we should not give hot pack because most of the people, the society or even medical practitioners, when we have to give hot pack, when we have to give cold pack, it's a very big confusion. That's why any acute is 0 to 5 days is acute, 0 to 7 days is subacute, 0 to 10 days is chronic. Suppose any acute injury like fall, any swelling, something, tissue damage, you have to give ice pack initially. Then subacute also we can give cold pack. Then chronic we have to give hot pack. Once we give hot pack in the acute, the blood vessels already dilated, the vasodilate the blood vessels, all intracellular fluid and all it will come out more, and it will the bruise swelling it will increases. Then the tissue damage it will be more. That's why initially we advise we have to give any injury, sports injury, like any common injuries, even like tooth extraction, whatever it may be. Initially we have to give ice pack only. After 5 to 7 days, then we have to, it will start the tissue, once slowly it will start the healing process, it will start. Then we have to go for hot pack, because that time the blood vessels will increase the vasodilation, the intracellular fluid and all it will go back to the extracellular, the swelling it will reduce. One neuropathic pain, we can see commonly in youngsters and adults and seniors, any person. This is spondylitis, spondylosis, spondylitis, these are the conditions. Spondylitis means the inflammation of the spinal cord, like cervical spondylitis, lumbar spondylitis, or anything like these conditions. The inflammation cause of the swelling, the radiculopathy, thecal sac pain, it will radiating hot pack. Definitely the patient they suffer quite badly. The tissue damage it will be more. We should not give hot pack. Only we have to give cold pack only, and patient to take the rest, and we have to assess the patient. We have to clear the swelling part. Swelling part is mainly we can give cold pack, and then slowly we have to new technology will come. ISTAT, instrumental soft tissue mobilization. New technology for pain management. We call it instance tools. This we call it as we can reduce the acute pains and chronic pains also. Suppose like neuropathic pain, we have to reduce the swelling and reduce the nerve pain. Nerve pain how to reduce? We have to relax the, suppose like cervical radiculopathy, we have to reduce the ulnar nerve pressure and radial nerve pressure and medial nerve pressure. We have to release the nerve pressure. Automatically the patient feels comfort with the pain, immediately it subsides. Physiological pain. Physiological pain means it's a psychological pain. patient, they don't know where exactly pain. Some people they say, for me it's like shoulder pain. Some people they say hamstring pain, cat, teeth pains, and they say psychologically they can't assess where exactly. Any medical practitioner or orthopedician or physiotherapist, we have to assess the patient. We have to discuss with the patient exactly what is the problem. We have to find out. According to that, we have to give the treatment. Mainly, when we have to give hot pack, cold pack, means blind thing. Any injury, initially we have to give cold pack. Suppose like any sports injury, fall, or trauma, anything like any extraction tool, whatever it may be, the acute inflammation will be there. The blood vessels already is dilated, the intracellular fluid and all, it will be extracellular swelling will be. You should not give hot pack. You have to give up to 7 days only cold pack. Per day 2 to 3 times. And chronic, you have to give only hot pack. We should not give hot pack. You should not give cold pack. And initially, you should not mobilize the patient. You should not, movement should not be there. Only they need rest 5 days. Then only they have to start the movement. In suppose like any injury like shoulder injury or knee injury, like any major muscle injury, we should not do quite a lot of exercises or gym activities. We should not do. We have to give at least 5 to 7 days rest. Then slowly, according to pain reduces, we have to start the regular activities. Thank you. Recent days, total knee replacement is quite common. People are, everyone, all the corporate hospitals, they're recommending everyone to go for total knee replacement. According to, I am a sports medicine specialist. First, we have to assess the pre-operatively, that we have to check the muscle power. Suppose patient is having less than grade 3, the patient is not recommended to go for knee replacement. We have to strengthen the pre-operatively at least 6 to 8 weeks. We have to strengthen the muscles like quadriceps, hamstring muscles. We have to bring back to at least 4 plus, up to 5, the maximum limit. The patient is muscle power is grade is 2 plus and 3. Then they do surgery total knee replacement. The success rate is almost very poor. Patient is recovery is very late and is not able to do proper exercise post-operatively. It is difficult way of walking, gait training it will be changed. The success rate will be very poor. Once muscle power it will increase, supposed to be up to normally 5 or 5 plus. Then we recommend to do the total knee replacement. Then 100% success rate it will be there. The post-operative physiotherapy also is very important. Suppose patient is having acute pain, we should not forcibly to ask the patient to flex the knee and some strengthening exercise. We should not do. Give the patient to the rest and give the ice pack or something. And slowly we have to mobilize the flexion. The range is maximum. It will now new implants up to it will come 130 to 135 degrees, the flexion of the knee. We have to slowly increase the range. Initially, most of the people starting itself within 5 days, 6 days, they increase the range. The patient also suffer quite badly, pain and the inflammation also it will increase. Total knee replacement patients, at least have to plan 0 to 6 weeks or 8 weeks. Slowly we have to increase the range of motion and other activities like increase the muscle burn. Depends on how much cut the muscles. Few people they cut the more in quadriceps muscles. They feel quite bad pain. The rehabilitation it will very tough for the patient. They can't flex that much easily. They're supposed to be surgeon, they cut the quadriceps muscles is less. The flexion of the muscles will be easy. The manipulation of the physiotherapy is also very easy. Depends on the surgeon and physiotherapist also is very main role. Knee total knee replacement, osteoarthritis people, first thing we have to assess either surgeon, either physiotherapist, any medical professor, we have to check the muscle power. Suppose muscle power is good, then only we can recommend for total knee replacement. Without that, without muscle power, better to not to recommend to knee replacement. This is my suggestion.